So, firstly, welcome everybody, and thanks for taking the time to attend this afternoon. This topic, psychological safety, I regard as no longer optional. It's an essential part of occupational health and safety. And we're delighted to have Peter speaking today. Now, I see this as an employer and employee issue, effectively, from a Thrive perspective. And that's what we see in the workplace. It's about productivity from the organization's perspective, meeting well-being, and they're perfectly aligned in my view. Now, I recognize most of the world doesn't share the same view, and what Peter's take will be, I don't know. I'm never quite sure what Peter's take is going to be, so that's one of the exciting bits about the webinar. And Peter, as many of you will know, is best known for his role with the UK Health and Safety Executive, where as a senior psychologist for 24 years, he was a constant in encouraging employers to consider the role of work in promoting positive worker mental health outcomes. He's a founder and director of Being Real Workplace Mental Health Solutions, and he's a mental health advisor to the charity Mates in Mind. Those of you that are looking at his LinkedIn or do look will find a number of other things as well. His decorated career includes working on the 2004 UK Stress Management Standard, which was the first of its kind in the world, and being on technical committees and a member of the ISO 45003 standard, which we'll talk about later on, which was the first internationally agreed standard for psychological health and safety at work. He's a passionate advocate for workers' mental health and recognized subject matter expert for mental health at work. Now, I first met Peter when he ruined a stroll around one of my big first wellbeing conferences that I went to. There was a fireside chat going on between an interviewer and some bloke in the distance wearing a rather loud shirt, who'd drawn such a crowd far beyond the space in the seated area that I had to walk all the way around it. People were spilling out in every direction to hear the spectacularly clad chap speak. As I walked round this obstruction, I listened and could not help but fall under Peter's spell. Since then, I've been privileged to hear him speak on a few more occasions, and it's always fabulous. I've also seen him passionately debate and in his refreshingly blunt manner speak truth to power. I've also encountered him on a couple of other occasions when he certainly made sure that this sort of topic was given a proper airing. So it was me personally that extended an invitation to Peter to speak today. I'm delighted that he agreed to do so and that so many of you signed up to listen to it. My job really, I felt, was to get the sort of audience that Peter deserves. And I think we can tick, we've done that. So thank you to all 124 of you that have joined so far. I'm expecting we'll get many more as well. So my job really is simply to hand over to the man himself to try and keep him to time, and then moderate the Q&A session at the end and close off. So to that end, would you please make sure that you drop any questions that you have into the Q&A session as we go along. Ella, as I say, is there under Thrive Mental Wellbeing, and will try and help me bring those together at the end. But it's now remains only for me to hand over to Peter. Peter, welcome. Thank you very much for joining us today.
I'm by HMD, or as it's known in government, Her Majesty's Government, so I will finish within the time frame. I don't go over, so I've been trained by the best. Throughout my working career, they've told us we couldn't do this. We couldn't do risk assessments for work-related stress. So we did with the management standards. We couldn't have a management system. So we did. And we couldn't tackle the inequalities. So we will. So I think it's really important that this whole area is littered with why you can't do something. This podcast is why you should do something and why you can do something. I think that's a really important elements to take away. I guess it's because of my overactive brain. I thought, well, if you can't do it, we'll find a way to do it. And that's what we have to do. We have to be creative. Unfortunately, a lot of us produce guides. We give it to people and we assume that they're going to read the guide. We need to be way more creative in mental health. Actually, 30% of the population have a reading age of below 10 years. And the guides that we produce are often produced with scientific names and comments, and people don't connect with it because it's not relevant to them. So what I'm going to try and do is to try and take you through the relevance of why psychological health and safety is important. And this is different from psychological safety, but that is important when people need to feel they can speak up, but they also need to be in environments that actually make it safe for them to do the work. During the course of my 25 plus years as an inspector, there was a number of times we came across a range of incidents where actually the psychological factor was hugely important in determining the outcome of the behavior that the person did. And in some cases, those, where we had to deal with fatal accidents, we was looking at what was happening, and actually what happens to the person's mental health is really, really important. So, could you do the next slide for me? So you've got two elderly gentlemen on here trying to make this work. So, so recognizing psychosocial hazards. It's important that we recognise them. You'll be interested to know when we go through what they look like, and actually they're everywhere. So it's not just simply the presence of depression or anxiety, which, by the way, has increased 25% according to the World Health Organization since lockdown. So during lockdown, we saw a relative increase, and now we've seen an increase of 25%. And worryingly so, we now have seen an increase globally on suicide, around 12% increase, okay? Just to contextualize this, pre-COVID, pre the lockdown periods, the average suicide rate in the UK was around about 3,300. We're currently looking around about 5,600. So there is a problem. So psychosocial hazards really do need to be addressed, and understanding that people's mental health is a significant factor both in their health and in their safety. Next slide, please. So, have you ever? It's a great list of these things. Have you ever been worried about your job? Experienced a restructure? Oh, by the way, has anyone experienced a restructure that was positive? Just interesting, because most people find that actually that it's not that positive. And experience harassment and bullying. Do we accept bullying? 8% of the working population in the UK experience bullying. 8%. Okay, unacceptable. And unacceptable at 1%, but really unacceptable at 8%. Yeah, 8% we know of, Jasmine, exactly. And it's those that don't talk about it. And we have to have systems and processes that pick up on when behavior is causing problems. Left your job because of a line manager. Also joined a job to be with another line manager. So all of these things, if you look through these characteristics, and you'll get these slide sets as a PDF, I'm sure, afterwards, are part of some of the psychosocial hazards you might experience. Next one, please. So let's have a look at what psychosocial hazards are as defined in ISO 45003. First of all, let's explain what ISO 45003 is. So ISO 45003 is a global standard for the management of psychological health and safety and well-being at work, okay? It's those psychosocial factors in work that lead to health and safety incidents. And they are also involved in how well-being is impacted, yeah? So actually, you could do a well-being initiative, but you could have a poor psychosocial health environment, and your well-being initiative won't work because people don't feel it's real and it's connected. One of the reasons my company is called Being Real was because when my dad passed 3 years ago, when he was alive, he said to me, "Son, why are they doing what do you do?" I said, "I talk about workplace mental health, Dad." And he said, "Well, why are they being real about mental health in the workplace?" And I thought, that's beautiful, isn't it? And so that's why the company is named after him. But this is what we were trying to do in ISO 45003. So let's have a look at the definitions. Psychosocial risk factors are those things that may affect psychologically and socially people's responses to work and workplace conditions. Guess what we discovered during lockdown? That social connection was important, and what we got in lockdown was social disconnection. I had a wonderful chat with a well-known researcher called Robert Karasek, and he said, "Peter, his models demands, control, support," and we'd always put extra emphasis on demands and control. because support would moderate stress-related issues. Well, when we were having this chat, he said, "Do you know what? I think it should be control demands that are there." And because we realize and support, so we realized just how important control was. People want to control their work environments. They control it when they feel like they were supported. Remember banging on the drums or pans out the windows? Well, I was with the nurses, one of the first face-to-face events. There was a Royal College of Nursing, occupational health nurses. It was quite a do. I was invited up to dance. Well, I wasn't invited, I was dragged up to dance. But before I was dragged up to dance, the people that were there were saying, "Do you know what? For 10 weeks, we were valued. We felt supported, and the power of support was really important." So what we need to realize is actually some of the things we did in lockdown were really good, and we stopped doing them, and we need to talk about that. There also psychosocial risk factors increase the risk of physical injuries, bad backs, shoulders lifting, and also accidents. There's a direct correlation between those. They're often hidden because it's around human failure, so that can increase risks across the organization. But essentially, what we're looking at is three hazards: the organization, the way the work is organized, the social factors, how they impact on people, and the work environment. You'll be surprised to see just how many things actually are occurring in the work environment that are psychosocial hazards. But it is a combination of the likelihood of an occurrence to exposure to a workplace hazard of a psychosocial nature and the severity of injury or ill health that might be caused by this. So hazards exist in the workplace. Manage the hazards, they don't become a risk in its simplest form. If you don't manage the hazard, they become a risk. The severity of that risk is there. Now, is there a likelihood for harm to occur? And that's what we're looking at. So hazards exist there, risk of when hazards are not being managed properly. Trying to make it as simple as you can. Next slide, please. So work organization can include roles and expectation, job control, workload and pace, and a number of other areas out here. Okay, so any of you got jobs that don't have any of these? Hello, we all have them, and at times when we have working hours that go over the recommended time frame, job security and precarious work, as we enter into multiple recessions, or sorry, they're not recessions anymore, the cost of living crisis, aren't they? Organizational change. I used to, when I stand at a conference, say, "How many people have gone for an organizational change?" They'd stick their hands up and say, "Yeah." I have, and universally, no one gave me 100% of enjoying it, because often change, when it's done poorly, is a good precursor to where work-related stress and mental ill health may occur. So work organization is very, very important, and it covers this range of tasks. These are the range of tasks that are in ISO 45003. Next one. And then the social factors. Look at this. These are the interpersonal relationships, how you get on with your boss, how you get on with your colleagues at work, how you don't get on with them as well. The culture in the organization. Do they let accidents, do things happen? Are things allowed to run the course? Is there a sense that you feel that you can talk about when issues are arising or something that might reduce your workload? Can you have conversation? Is the leadership living by the same values? And the leadership is multifaceted. It's not just the board. It's not the chief executive alone. It's everyone in that structure. Yeah. So it's your line managers, it's your supervisors. And actually, we need to see that our leaders in all levels are exhibiting the right behavior. This isn't something you need to go on a training course about. Yeah. These are some of the things you should be basically doing to look after your people. But we do put people on training courses to be better managers and better leaders. And we cover areas like this. Work-life balance. I hear people saying, "Oh my God, I worked 14-hour days." Well, that's okay. But the problem is after 9 hours, you get an error rate, because the longer you work, the more statistically likely you are to have an error. Now, if you're writing an important document and you're doing it for 14 hours, when you actually look through that document, you'll find there are errors in the last 5 hours of the work that you've done. We're not timed to be doing 14-hour days. Our brains neurologically need about 8 hours of sleep, 8 hours of something that's detached from work, and about 8 hours in work. Yeah. In its simplest form about 25 years ago. Well, obviously that doesn't exist at the moment, but we do have to have quality work-life balance. And I think that's the difference. So next one, please. Now look at this: work environments and hazardous tasks. Noise. Loud, noisy places impact people's psychological well-being and their health. Lighting does. We have lighting standards which require a certain level of lighting to be present, because we know that in darkened places of work where there's a lack of sunlight, that can lead to distraction in people, because whereas it be too bright can lead to overstimulation. So actually, lighting is really important. I've been involved in a fatal investigation where lighting was involved, and actually a simple measure of the light being too high a voltage was a significant factor. So you have to think about these things. Musculoskeletal disorders, or MSDs, lifting and that. Now, what happens is when you're mentally in a difficult place, you do things really randomly. Like you put boxes up and you bend over. You lift without bending down. You lift it straight up. So what happens is your psychological environment impacts how you do your physical tasks. So if you're on a factory and you've got multiple items coming down, the faster you're going, the more likely you're going to get injury. It was interesting. I went to one place where they had to pick up biscuits and put them into a biscuit container, which had 3 holes in it. And each time that they did that, I wondered over 7 hours and 10 minutes of how many times were they actually picking up. Now on that particular space, there were 8 people on there, and they moved on to one place, not necessarily one different role, but one place. I calculate there's about 17,000 repetitive movements. 17,222 to be precise. But the point being is the way the machine and the business was designed, it didn't consider the musculoskeletal, and that's a systemic issue. So we'll come back to that later. Chemicals are also issue. Temperature, cold temperatures, hot temperature. We discovered COVID was, as you'd expect. The availability of equipment when we're all thrown into going to work from home, but had no computers or desks to work from. I like working in my kitchen because I have sunlight, and but I also have an office. And also civil unrest and war and kidnapping also impacts. So these are all the things that come into play as well. So next slide, please. So work organization, as we would summarize it on the management standards, is demands, control, role, and change. That's your work organizational factors. And the social factors of the 6 HSE management standards include support and relationship. Okay, so these are the 6 management standards. If you go to HSE's website, you can have a look at that and see for yourself. And what you'll see is these are all based on the work of Karasek, who I've talked about, whose demands, control, support model, and also on a number of others. If you want to reach out to me on LinkedIn, I can give you the references, and I have them. So, okay, that's my geeky side, but they're very good to read, and and so let's do the next one. So our psychosocial risk a problem in your organization? Well, yes, is the simple answer. These are some of the reasons why. Now, if you're successful and a company achieving what you want to do, there will be characteristics that you'll see in there which are the opposites of this. Successful companies where they look after people have higher productivity, they have growth which comes naturally because their people feel looked after. In those that are not, there's a plateauing on health and safety instance. Instead of it going down, it just plateaus because people aren't taking it seriously. There's an increasing report of stress and burnout, and an increasing absence and retention rate. People move on. They move on because they can't be bothered to be in the organization they're in because it doesn't look after them. Next one, please. I'm not going through all of them because you'll get the slides, you can have a look. I'm definitely not going through all of these, but this is where you start. Review your current risk assessments. Look at job descriptions if you have them. Consult with your workers. Always consult with your workers and analyze your work tasks. For some of you, you're starting the journey. Start on these 4 principles at the top. Yeah, get that in place, and then start to work your way down down the list to help to identify those hazards. Your people know your hazards. You just have to accept that they will tell you what those are, because they are very likely to tell you if you ask them. Ask your people where they are. I think they will be, won't they, Martin? Yeah, they will be shared afterwards, but in a PDF form, because quite a few of my slides have been robbed, and then people are selling them, which is yeah, it's interesting. You go on websites and buy your own slide set. Okay, so next slide, please. So when we're identifying risk, it's the same principle as any safety risk. It's who, how often, and what are the consequences. You need to ask yourself, is it chronic or is it acute? If it's chronic, remember that the more chronic it is, it can develop over months and years, and then it's harder to break that behavior. Whereas if it's acute, you can make changes to the work environment fairly quickly to take out that particular acute element. Do dynamic risk assessments. If you're going to do change, expect it's going to be, okay, it might cause you some problems. Do it properly though, and it won't. There's an interesting theory called Prochaska. It's called the theory of change. And Prochaska said that most organizations, most of the people in the organization are there pre-contemplation. Okay, we're going to change, but we don't know why we need to change. We don't understand why we're changing. Most management and leadership are at contemplation, but they're not communicating why they want to change and why there is a need to change. So remember, so the science here would say that actually during change, we can categorically say if it's done poorly, we will see a correlation. And I've done this with organizations. I've gone back 6 months later and said, have you got problems in this, and this area? And they've said yes, because that's how predictable it is. Because if you do too many change programs at once, it confuses people, and people are not able to adapt to the new ways of working. New slide, please. So taking action. Hello, you've got a problem, you've identified it, you've got your hazards, you've identified a risk. So engagement survey is not enough. How many of you got engagement surveys where everyone said, I'm really happy? Anyone got a wellbeing survey that said they're 100% happy? Just let me ask you, what do you do with the ones that are not happy? 35, 40%, 50%. By the way, from a regulator perspective, that's called foreseeability. And I have looked, when I've issued notices, all sorts of, not just your risk assessments, but also your surveys. Because if you know you've got a problem, you've done nothing about it, then the foreseeability argument is lost, isn't it? So, and this, we had trained, prior to leaving HAC, I trained about 750 fellow inspectors who were going through it to look for all valuable evidence that you've got there. Okay. So when we look at it, we look at primary interventions, which is at the top level, secondary and tertiary. Just for reference point, we've changed it. We are now using the World Health Organization definition, which talks about prevent, which is primary, promote, which is secondary, and support, which is tertiary. Yeah, I think that's a much simpler way of explaining to people in work what we're looking at. We want to prevent at source. We want to, by looking at the systems and processes, we want to promote mental health and promote well-being so that we protect people. That's the next level underneath it. And when they do fall ill, we support them. So it's prevent, protect, support, prevent, protect, and support. And it's on the World Health Organization. And I think that's really, really a good way of explaining to people out there. As I said from the beginning, make it simple, make sure people understand. And remember that the protect bit is what we're doing is what we do with anything that's out there that's potentially a risk. We protect people from the harm, yeah? So we put guardians on the machine to stop people's hand getting caught on a lathe. Well, what we're doing with the management of mental health is we're putting a guarding between the person and the job. Yeah. So that's the protect element. And that's where if you're doing prevention with promotes together, you create an environment where you protect people. Next slide, please. So look at this. Psychosocial risks are organizational level risks. They have to be addressed at an organizational level. The problem is we address them at an individual level. So we go and put people on mindfulness training, we put them on resilience training, and then we put them back into an environment which is actually toxic. Now, some of you, if you followed me, will know about the goldfish. They say it's a goldfish analogy, but it is actually, I did kill the goldfish in my pond. And the reason was I built this beautiful pond in the back garden, and I put these very expensive goldfish stroke koi carp in the pond, and it was my absolute pride and joy. And about 8 weeks after I did that, I came down one day and all the fish were dead. So I phoned up Pete, the pond man, and I went, Pete, you've given me bad fish. They're all dead. And he said, I haven't given you bad fish. They were quality fish. So he came down, he looked at me, pond, and he said, Peter, this isn't the problem with the fish. You lifted up the filter, which was full of frog spawn. He said, you poisoned the water by not checking the filter. And it's the same for us. If you make people resilient and mindfulness, but don't actually put them back in the right environment, they're still going to get ill. They'll maybe get ill in a longer period of time, but they will get ill if the environment isn't wrong. And here's the thing: why do we have fire alarms? It's to alert the fact that there's a potential fire or there's a fire there. Yeah. Why do we default to using a fire extinguisher on mental health? We go, oh my God, there's a fire. There's somebody with mental health. They've used a fire extinguisher to put it out. We should be looking at the fire alarm, because that's telling you there's an emerging problem. So if we look at the fire alarm as a way of looking at it, the risk profile for some risks will be different for some groups of people. We know that, okay? But we have to manage that. Young workers, pregnant women, amongst a whole range of others. But as you approach it, as you would fire safety, organizational risk management first, personal evacuation plans only when needed. I love, because that for me is what it's about. Yeah, just, oh, there's a fire alarm. There's a fire alarm. Do you know what the fire alarm is? It's your wellbeing survey saying you got 40% of people not very happy. It's your staff survey. It's your sickness absence. There's all of these little fire alarms going on, but you're waiting until you've got a need to put the fire out. So next slide, please. So you don't need to be a psychologist, and that's intentional. Even though I am a psychologist, we want people to do this. We will simplify it, simplify it, simplify it, and simplify it. Make it easy for people to understand. It is about health and safety risk management, just like bad backs, just like asbestos. Every other thing that we challenged, we said it was too difficult to do. We did. We no longer have the grace and the time not to do something here. Yeah, we have to do 20 million days could be the target that we're heading towards for days lost, and 1 million people off with depression and anxiety due to work. Okay, now when does it stop? When do we go, that's a bit too much, isn't it? And actually, we intervened when asbestos was killing people. Remember the numbers? This is the important thing. If we don't do anything on mental health now, we risk absolutely causing huge problems for this generation, the generation coming in, and the generation before. I do not want the legacy of our world of work to be people commonly made ill by work for something that's preventable. Sorry, that's my little high part moment. But this is why I do it. That's why I've been doing this for 27 years, saying Let's tackle it. Let's tackle it. So it's quantitative and qualitative. You want to understand what your people are saying, and you need health and safety and HR as well. Identify, assess risk in exactly the same way. Stop using excuses that you can't do it because it might be at home. I don't care if it's at home, okay? Because if you're coming into work and you know someone's going through an issue at home, good management is that you manage that. You don't go, oh my God, you've just gone through a bereavement, therefore I'm not going to do anything, do you? I've gone through a divorce. I've had a bad day. We manage people, and so next slide, please. So costs. This was about 4 years ago. 51%, now 57% of. And we've also, in terms of working days lost, it accounts for 62% of working days lost now. It's on the way up. The average cost is 18,000 per absence, and the average absence could be 6 to 8 weeks. After 8 weeks, people don't generally return to work until 6 months. Cost of turnover 25,000. That's the straight basic cost. The Treasury said it's tough. When we did some work with the Treasury, it's 4 times the straight cost that you lose. Yeah. So you're losing 25? No, you're losing 100. You got 4 people left, you're losing 400,000 to your business. The numbers are kind of there. Next slide, please. So HSE had a 10-year strategy plan to reduce work-related health with a specific focus on mental health and stress. We are calling for a culture change across Great Britain to ensure psychological risks are treated as the same as physical ones in health and safety. That was my call as I left HSE, that I wanted this to be in HSE's strategy. Having spent years and years on mental health, it needs to be there. This is the biggest occupational health crisis this country and globally we are facing, and we have to do something about it. Next slide. I'll be finished shortly, Martin, you'll be pleased. Psychosocial risk and workplace wellbeing. Workplace wellbeing, I think it's good to have the definition. It's the fulfillment of physical, mental, social, and cognitive needs. And it's the expectation of workers, work related to their working environment. It's not just about making them mindful, and it's not just about giving them pizzas, and it's definitely not just about giving people massages. It's everything. Make the work environment right, and you get effective people working. Next slide, please. So there's some further information that you can go through, and how it impacts the WHO and ILO at mental health work policy brief is a really good one to get hold of. And if you come and visit me on LinkedIn, we can get all those. I can send some of those over to you. And next one, please. Oh, it's any questions. There you go. And as agreed, Martin, as agreed, it was 30 minutes and we started at 12:06.
Spot on. Brilliant, Peter. Thank you. There was so much energizing and exciting stuff in there. I've got some questions I'm going to raise in particular, but we do have a question, I think, from Caroline Joy in the Q&A. I'd like to invite anybody else to put any questions that they have. But Caroline's question is, do you have a MHRA template that you use or can recommend?
I mean, there are a number that are out there. I've obviously used the management standards template, but I've also used it with cases where individuals are involved. So there's actually a template on HSE's website for the management standards risk assessment. I'm working on my own mental health risk assessment, and I've got some templates which I'll be releasing probably in the next month or two, that is exclusively around mental health in the context of psychosocial risk, and they're being developed, and then I'm going to be testing them out, or I'm currently testing them out as well on organisations to make sure they're doing what I think they should do. So there are different ones out there. Essentially, you just need to understand what are your risks, what are your hazards, and what are you doing to manage those.
Okay, but the HSE website basically, and then there are lots of other good ones. Okay.
Yeah, there are lots, and they all have different. You see, as a scientist, I'm going to obviously they all have different benefits and negatives and positives. And the same with the management standards. You know, we didn't have in the management standards, we didn't have foreseeability and duration and frequency in there. We should have had duration and frequency. In some of the new ones that are being produced, duration and frequency are in there, because how often it happens and when it happens and for how long are very important in determining where someone's mental health might be impacted.
Okay, well, we'll try and pop the link to the HSE one and any others that Peter can come up with into the follow-up notes. Peter, a question
in a few weeks, I'll be releasing some mental health risk assessments myself, and you know, that's one of the things that my business does, which is we assist organisations in doing mental health risk, but I bespoke them to the organisation. There are core elements and core questions that you should have in there, but then you can bespoke them, because you know, if it's an industry that's involved in tech, you need to have some tech relevant psychosocial risk stuff. If it's you know, retail, then you have to have retail. So that, but you have to have core questions that you can use.
Sure. So to answer Hillary's question, yes, we will send follow-ups, but watch this space with Peter. So next question from Alex Prince: have you found any good approaches when talking to employees to identify risks? Is it best one-to-one or in a group, for example?
I always think that one-to-one is useful. So if you're a good line manager, and you should be listening to what your people are telling you. Groups are good. Small groups are better, because then they don't bounce off each other. And I like to mix it. Well, I like to have management in on the groups, because I need them to see the reality of the situation, and they need to also then talk about their own reality, because those in management are also subject to the same pressures that those who are not in management. So, and then sometimes, you know, if there's a dispute, you don't want that to happen. So you need to understand who's in your group. So if you've got a particular, say you've got a particular person that's likely to be controversial, you want them to be in a group where they're not controversial with a load of other people. So you've got to really think about the structure of your groups.
Got it. Thank you very much indeed. Rebecca asks, how would you approach the topic of encouraging this when it may not be seen, I'm guessing potentially by perhaps the higher ups, as they're sometimes called, as not being important?
I just refer back to the data. I'd use a sickness absence day. If you've got 4 people off, go back to your management and say, how much are we losing? So it's the salary cost of the amount of time they're off times 4. I did this with investment bankers. It was very interesting. And they had 3 investment bankers off. Their annual salary was 10 million. And they were off for 3 months. So I said, how much do you think you've lost? And then they went, oh, bugger, you know, we've lost. They were paid in the region of about 7 million. I know it's an extreme amount of money, but actually, when you market it, they said around 2 million. And I went, no, you've lost 10. And then there's that moment, and you're telling, you know, we were talking about the cost benefits of doing a health and well-being and mental health, you know, wide sort of approach. And this was 15 years ago. I hate to think what the numbers look like now. So,
me too. Questions are coming thick and fast now, Peter. So from Andy, aside from employers' responsibilities, what responsibilities should employees take for managing their own personal psychological safety?
I think they have to be honest with their line managers and with their subordinate, and you know, that's a technical term, isn't it? If your line managers or your colleagues, talk to your colleagues about how you're feeling. Your colleagues that can offer listen, not necessarily always offer the advice that because that might be something that requires the line manager to get involved. But it's equally a duty to tell someone, look, what you're doing here is making me ill. And there's a measure of saying, you know, could we work together here to improve on this? Look, I'm going through a divorce, and I'm experiencing a really difficult time. I just need a little bit of flexibility. Do you mind? Can you work with me to help me position my work in a different way? You know, The problem in the world of work in the UK and globally is we put the system first and not the person. Switch the narrative, yeah? Change this, adapt the system to help the person during that relatively short period of time. But if you don't, it becomes a much bigger problem and a larger time. So there is, so going back to that stuff, is you've got a duty of care to tell, but if the system is functioning at a way that's going to make you ill, you need to say that's the case.
Absolutely. We'll come back to that in the next question, but I think I think it links to that one, but I'll ask them in the sequence they came up. So we had an anonymous question. Do you think companies and the NHS are equipped to deal with burnout?
Yeah, they are, but they don't. So they wait until someone's burnt out. With burnout, there are indicative things that occur all the way along the process. Good risk assessments pick up the embers of burnout. If you're doing a risk assessment and you've got questions in there that indicate that people are feeling tired, fatigued, and not and having bouts of mild depression, these are indicators that they're on their direction, they're on that trajectory of burnout, yeah. And unless they're managed, they will probably have that period of burnout. They will, remember this: people do return from burnout, but it's a shocking experience. So I think you have to, from a burnout perspective, you have to make sure, particularly in the NHS, you got an annual staff survey, you got risk assessments everywhere, is actually act upon the data. I issued notices against an NHS trust back in the day, 2005. It was you search West Dorset NHS Trust. So we were doing this 20 years ago, 23 years ago to be precise. So it's not like it's not unknown in the sort of healthcare environment. We identified banking, healthcare, and social and local government as higher factors for work-related stress back in 2005. The difference now is that those have moved into other sectors. So insurance and banking, retail is high.
Thank you. Now,
loads of new messages coming through.
Yeah, there's a lot of other people just a few people just saying goodbye. So I will wrap it up in a few moments, but I think we said we'd run till 1. So I'm going to ask Abigail's question, which I think potentially goes back to the way you answered Andy's question about how people, because I could almost hear people thinking, well, okay, but could I actually say that in my workplace? To what extent could I take responsibility? So I think she asks an associated question, which I think will be a clarion cry for lots of people who have attended the session, Peter, which is Abigail's question. You've said psychosocial safety is an organisational responsibility and that wellbeing activities can't fix a toxic culture. But for those of us without that power, who are trying to improve things in our teams, where do our efforts fit in? Are we just putting a plaster on the issue, or can small changes still make a difference?
Yes, is the answer. Small changes can make a difference. And they are often the instigator to the larger changes that need to be made. One of the reasons we get people to do risk assessments and then go back and do focus groups is most of the solutions that will help to reduce some of the impact on people in toxic cultures are cost effective or cost neutral, and they come from within. And that's really, really important, because there was a report back in 2004 that said, called The Spice of Life. It was a European Union report that said, if you assess and fail to do something about it, you create a more cynic environment. So do what you can to make those small changes. But if you're going to do well-being, why don't we look at how work is designed? Why don't we look at how 4-day weeks, or are we encouraging people to take breaks, or we discourage them by making them work through their lunch hour? And there's simple things that you can do. The sticking plaster for me is if all you are doing is putting mindfulness and resilience and some yoga and pasty Friday as I went to one place, then it is a sticking plaster. Because if the wound is there and you're not stitching it up by doing the systemic stuff, it's going to seep through. Even the best plaster will eventually give way. So. Yeah, but you remember this. You are the best advocate. So this thing about who we don't have the power, you do have the power. The power is you and what you do as an employee to say what we want to make it a better place. And then the sell-in to the board is happier, healthy people make productive companies.
Brilliant. Thank you very much indeed, and inspiring stuff. So one more question, and then we've got a couple of slides just to close off here. So I just want to take you back to the topic for a second. This is my question, Peter. So in leadership terms, these people that we just talked about that make the decisions, in particular, how can they and organisations prepare themselves in the best way for a 45003 audit?
Talk to me. In developing ISO 45003, because I was on the committee for it, we sought to make it easier than any other sort of management system because it was dealing with people's psychological health and safety. But in preparing yourself, when you go through this process, they need to show you need evidence that you are aligning yourself with each of the clauses. There are 10 clauses, and it's clauses 4 to 10 that are the significant ones. So in looking at that, you need to have evidence to show that you meet that. So you have to do a gap analysis, and that gap analysis is part 1, and part 2 of accreditation certification is that somebody comes out and audits you and finds out that you've done it. One of the things I've done and continue to offer is I do the gap analysis. So I take this ADHD dyslexic brain and zoom down at what your information is and try and assess what you've got and where you've got gaps and give you an honest opinion to say, yeah, I think you're ready, or actually, if you can do these things, I think you will be ready. So give yourself 12 months and these are the things that you need to do. I went on ISO 45003 because I was just tired of telling people what to do and then not giving them something to do. So in the principle of ISO 45003 was to say, here's a management system agreed by global experts, and it takes you through what we need. And those clauses, they have sub-clauses in them as well. They can be terrifying. I appreciate standards, but when you can sort of look at it in the context, well, what we're trying to do is to create the right environment, the right place of work. So yeah, so I guess that kind of in a longitudinal way answers your question.
So thank you very much. Well, I think we'll get the link to that in the last slide. So if I may, I'm going to ask Ella to pop the next slide up. So I want to thank everybody. A couple of kind of sentences about Thrive, and I guess I want to echo what Peter said. He talked about we're heading towards 1 million people off work with anxiety and depression, and he didn't want his legacy to not be doing something about that. When I first came into this world from a different angle, much more recently, only from 3 years ago, I came in here because I thought that something needed to be done. It needs to be done in the right environment to be effective. And that's what Thrive tries to do. So that we do have an app, and with a simple access code, you can download the app and you can access it, and that's provided by employers. So 2 paragraphs about Thrive, if I may. Thrive stands alone in targeting the unwell population in the workforce. And that's what's different. The app allows people to practice mindfulness, to sleep better, access CBT and digital therapy, etc. But the real power of the Thrive service lies in its ability to identify and engage with the unwell early, guiding them to safety. In some cases, we are able to affect that appalling statistic on suicide that we talked about earlier on. Okay, but in doing that, where required, we also provide an uncapped therapy service, and we get 90% of people into help-seeking behaviour, and 86% of people recover. We know 1 in 6 in the workplace employees face mental health issues at any moment in time, and we focus on getting to those people, allowing confidential and anonymous access. And for those whom the clinical scales in the app highlights they have symptoms of being unwell, it is anxiety and depression, Thrive reaches out with a therapist in near real time to manage that situation, keep them safe, arrange a full assessment, and if required, this full uncapped course of therapy. So that's kind of what we do. If I may, then the next slide, Ella. Just one quick summary slide. Pete's got a great website. He's not just good one-to-one and in the flesh and verbally. There's good content there, but I'd really encourage you to contact Peter, to look at his website. He's invited everybody to contact him on LinkedIn. He's given us a real passionate session today, and I hope he's fired people up to asking to get some help. And I know he said he'll do us a bit of a dispensation. If you mention that you've been on the webinar today, he's promised some very attractive rates for any conversations that he has with people, particularly before the end of July. I think he'd like to plan perhaps sometime later in the year after the summer. So listen, everybody, thank you very much indeed. I hope you all agree that it's been a very worthwhile event. Peter, thank you very much for your insight.
May I say one last thing? Be real, okay? Be real about workplace mental health, because we are not in the moment of not being real. And for me, this is a mission in my working life. And I'm 58, okay? Do not let me have these same conversations at 67. Please be real. We can tackle this. We can make a difference. We can improve. This is not a task that can't be managed. We did it we've managed asbestos, we've managed bad backs, we've managed all of the hazards that come along, and we've sat back on this and gone, we can't do it. It's like time for action.
I have no better way to close than that. Thank you very much, Peter. Thank you, everybody that's attended. We'll send all the follow-up information that we said we'd send. And if you want to attend any other webinars that we're doing, just run across to the website and you'll be able to register there. Thank you very much. Have a great afternoon, everybody, and look after each other. We are all responsible.